In our today's lecture, we will start of a new chapter, that is the early effects of radiation. And we have previously discussed about the deterministic and stochastic effects. We know that the early effects are also called the deterministic effects of radiations, and the late effects are called the stochastic effects of radiations. So we will go through some major factors and some very important periods that are basically the events of radiations that occur after the radiation of a person. So, what basically is the deterministic effect? We already are familiar that the early radiation responses are called the deterministic effects, and deterministic radiation responses are those that exhibit increasing severity with increasing radiation dose. So it has a threshold, unlike the stochastic effect that does not have a threshold. So the severity of the deterministic effects will increase with increasing radiation dose, and for every syndrome to occur that will be related to the deterministic effects, there will be a threshold dose. So we can say that there is usually a dose threshold. Before introduction of proper personal radiation monitors, radiology technologists had to pay visits to the hematology laboratory um, to get themselves checked. But now, after the introduction of the proper personal radiation monitors, one can check the radiation dose 6 monthly or annually, and we can um, get the idea that how much the radiologic technologist has been exposed to the radiations and what dose has been given to the radiologic technologists. So there is no known death case related to the diagnostic radiology. So the topic that we are going to discuss is the acute radiation lethality. So once again, as I have told you earlier, that there are no known cases of deaths related to the diagnostic radiology, but there are some incidental exposures of persons in the nuclear weapons, and there are many incidents that has happened. The one that happened in April 1986, and the one that happened in 1979, that was the incident of nuclear power reactor at the 3 Mile Island, Pennsylvania. But still, the employment in the nuclear power industry is a safe occupation, because now every department follows the proper radiation protection rules. So it's safe to work in radiology. So diagnostic X-ray beam always result in partial body exposure that is less harmful than the whole body exposure. So the sequence of events that follow the high level radiation exposure leading to death within days or weeks is called the acute radiation syndrome, which is very important. And by definition, the acute radiation response or syndrome is the sequence of events that follow the high level radiation exposure that will lead to the death within days or weeks. You already are familiar with the terms acute and chronic. So definitely acute is a emergency situation, and there will be cell death within days or weeks. And there are very important three separate syndromes that are related to the early effects of radiations. And these syndromes are hematological death, gastrointestinal death, central nervous system death, and these all syndromes have clinical signs and symptoms, and they have a threshold dose. We have some important factors as well, and we call them the periods that are associated with the acute radiation lethality, and these are the prodromal period and the latent period, and we will discuss these individually. So if we talk about the prodromal period, then this is basically a period in which a person will start showing the signs and symptoms of radiation sickness, and that can appear within a matter of minutes to hours. So it has a threshold value, and prodromal period will occur at radiation doses above approximately 100 rad delivered to the total body. So the point one here to remember is that the prodromal period has a threshold dose, and it will occur at radiation doses above approximately 100 rad delivered to the total body, and the signs and symptoms of radiation sickness will start appearing within this period within a matter of minutes to hours. And the symptoms a person will show will vary, and the signs and symptoms can be nausea, vomiting, diarrhea, and leukopenia, that is the reduction in the white blood cell count. So this is the immediate response of radiation sickness, and we call it the prodromal period. The duration of prodromal period is from few hours to a couple of days, and the severity of the symptoms is dose related. If the dose is in excess of 100 rad, then the symptoms will be violent. So the factors that can affect the prodromal period are the severity and the duration. The more the dose is, the more violent the symptoms will be in the prodromal period, and so is the duration. Duration is also very important. Next period that we are going to discuss is the latent period, and this is basically the period after exposure during which there will be no sign of radiation sickness. So sometimes it is mistakenly considered as the period of recovery, because the patient will not show any apparent signs and symptoms, so they consider it sometimes mistakenly the well-being period. The latent period also extends from hours or to weeks, and it also depends on the doses. It will last for hours if the doses is in excess, and if it is let's say 5,000 rad, and it can last 2 weeks if the doses are from 100 to 500 rad. So just remember that it does indicate, and we can mistakenly thought it to be an early recovery period from a moderate radiation dose, but that's basically not. The next is manifest illness stage. That is the stage that depends on the specific syndrome, and it can also last from hours up to several months. or this is the dose that is necessary to produce a given syndrome. Next, we will talk about the recovery or death as well, and that those patients who do not recover, definitely they will die within a few to several months of exposure, and the recovery process lasts from several weeks up to 2 years. Now we will discuss about all the syndromes that are basically related to the early radiation effects. So the first syndrome that we are going to discuss is the hematological syndrome, and we have already discussed about the periods. So those all periods or events will happen in all syndromes. So the first point is, which is very important, is the range of the dose in the hematological syndrome, and that is from approximately 200 to 1000 rad that will produce the hematological syndrome. What can be the signs and symptoms? That is also very important. The patient will start experiencing the mild symptoms of the prodromal period within a matter of few hours, and it can persist for several days. The latent period can extend as long as 4 weeks, and the patient will start feeling well, and there will be no obvious signs of illness in this period. Next, we have the manifest illness, but before discussing about the manifest illness, just remember that there can be some signs and symptoms in the latent period, as we discussed here, that the patient may experience fatigue and weakness, but if we perform the blood test of that patient, then we can find that there will be reduction in the white cells, red cells, and the platelets of the patient. Now we will talk about the manifest illness, and as I have already told you that this is basically the dose that is necessary to produce a given syndrome, and in this period the patient would have vomiting, mild diarrhea, malaise, that is the feeling of not feeling well, lethargy, and fever, and each of the types of blood cells will follow the cell depletion. So if the dose is not lethal, the recovery will begin in 2 to 4 weeks, but it can take as long as 6 months for full recovery. So the manifest illness phase can be characterized by the neutropenic fever, systemic and localized infections, sepsis, and hemorrhage, and that is basically the body's defense against the infection that will be nil. And just before that there will be hemorrhage and dehydration, and it can be pronounced, and the death will occur because of the generalized infection, electrolyte imbalance, and the dehydration. So this sign is very important, that if the dose is not lethal, then the recovery phase can take as long as 6 months, and if the death is obvious, then definitely before death there will be pronounced hemorrhage and dehydration, and the death will occur due to the generalized infection, electrolyte imbalance, and hemorrhage. And the mean survival time is 10 to 60 days. The next syndrome is Gastrointestinal Syndrome, and we will also learn it in points. So the first point is the range of dose that basically is required to induce the gastrointestinal syndrome. So the radiation doses of the gastrointestinal syndrome range from 1000 to 5000 rad that will result in the GI syndrome, and there will be depletion of the epithelial cell lining, lumen of the GI tract, and due to that the intestinal bacteria will gain free access to the body. There will be hemorrhage and loss of absorptive capacity. The prodromal symptoms would be vomiting and diarrhea that will occur within hours of exposure, and they can persist for hours to as long as a day. And the latent period would be of 3 to 5 days, during which there will be no symptoms present. The next period is the manifest illness, and it will begin with a second wave of nausea and vomiting, followed by diarrhea, and the patient will experience a loss of appetite, that is anorexia, and it may become lethargic. And the mean survival time is 4 to 10 days. So here we can summarize the systemic effects of GI syndrome: malabsorption resulting in malnutrition, fluid and electrolyte shifts resulting in dehydration, acute renal failure, cardiovascular collapse, GI bleeding resulting in anemia, sepsis, paralytic ileus will result in vomiting, abdominal distension. And the GI death will occur principally because of severe damage to the cells lining the intestine. The next syndrome is central nervous system syndrome, and it will occur when the radiation dose will be in excess of approximately 5000 rad, and there will be a series of signs and symptoms that will occur and that will lead to death within a matter of hours to days. First, there will be severe nausea and vomiting, and that will be usually within a few minutes of exposure. And during this initial period, the victim may experience extreme nervousness and confusion, and the patient will also complain of a burning sensation in the skin. There will be loss of vision and loss of consciousness within first hour, and the next will be the latent period that will last up to 12 hours, during which the earlier symptoms may subside. Next is the manifest period, during which the symptoms of the prodromal stage will return, but they will be more severe in this period, and the person will become distorted, and there will be loss of muscle coordination. The patient would also have difficulty breathing, and the patient will experience seizures as well. There will be loss of equilibrium, lethargy, and patient may lapses into a coma, and the ultimate result will be death. So, regardless of the medical attention given to the patient, the symptoms of manifest illness appear rather suddenly and always will be of extreme severity. And at radiation doses high enough to produce a CNS effects, the outcome is always death within a few days of exposure. So we can say that the ultimate cause of death in CNS syndrome is an elevated fluid content of the brain. And the CNS syndrome can be characterized by raised intracranial pressure, vasculitis, and meningitis. So that's all for today, and if you have any question regarding this lecture, then you can ask. Thank you so much.